Arkansas ranks third in the nation for pregnancy-related deaths. According to a recent report, those deaths are disproportionately impacting black mothers. 5 News reporter Zoe Henry shows us how this data can be used to find a solution.
They're afraid. Black mothers are afraid to birth their babies.
The Arkansas Maternal Mortality Review Committee released a new report that they say breaks down the numbers behind that statement. The report shows that in 2018, black women birthed 19% of Arkansas's babies and made up 37% of the pregnancy-associated deaths in Arkansas.
This should be a wake-up call and a stark call to action for us to address maternal health in the state of Arkansas overall.
According to the research, black mothers are 2.3 times more likely to die than white mothers. Several factors contribute to the data inside and outside the healthcare system.
We do not have providers everywhere we need them in the state. Some areas don't have a hospital you can give birth in. Some areas don't have OBGYNs. And then when you look inside the healthcare system, women of color don't get the same quality of care as everyone else.
In the natural state, there are no black licensed midwives. 2 women in Central Arkansas are looking to change that. While seeking certification as midwives, Nicole Fletcher and Sarita Hendricks started Ujima Maternity Network. Their goal is to help alleviate fears of death.
You shouldn't think about, am I going to survive this, or is my baby going to survive this? But that's what we're hearing of women around the state.
She says trust and emotional support could lower the high maternal death rate.
So really, and a huge portion of that is creating space for women to see other women that look like them as practitioners, as people that can actually serve them, qualified, skilled, like birth workers that are coming along and letting, again, that space where they can let their hair down.
With that margin of comfortability, patients are able to communicate and advocate for themselves, and doctors can provide better care to help prevent 92% of deaths caused by preventable illnesses.
So, there was a report done by the Arkansas Maternal Mortality Review Committee. And while all the data and statistics that we've been talking about are quite alarming and scary, the good news is that they found in their review 92% of the deaths that occurred were potentially preventable. That means there's something that we can do about it. We can ensure that women have care. We can ensure that women get quality care and that they and their families are taken care of.
Covering news where you live, Zoe Henry, 5 News.